Hello, and welcome to Dr. B Talks About Hoarseness, trying to answer the question for you, why am I hoarse? I'm Dr. John Burgoyne. I'm a practicing otolaryngologist in Austin, Texas, and I have over 30 years experience dealing with hoarseness and other vocal cord problems. But today, we're just going to talk about what things can cause hoarseness. So the other part of that is, well, when should I be worried about that? So to get there, we need to talk about how the voice works. So this is a model of the outside of the voice box in the upper throat. Voice box is in there. It's called the voice box because it's hard and it's like a box. If we look on the side, this is the tongue. It goes, the airway goes down here, and breathing happens in the front here, and swallowing happens down the back. This right here is where the voice box is. Oh, circle's a little off. It's okay. If I look down from above, either with a little mirror or with a flexible scope, I see vocal cords that are open and wide like this when we breathe and are held really close together when we talk. So we take a breath in with our vocal cords open, we close them so they're tightly held together, and it's pushing the air through that tight set of vocal cords right next to each other that creates the sound. So it's kind of like a sort of thing, except obviously better controlled and in our voices. Okay, so if this is the normal situation where when we breathe our vocal cords are open and when we talk they're close together, what kind of things can go wrong with that? Well, the first thing is, well, what if these vocal cords are swollen? So that we put, they're swollen here, and that way when we try to talk, they don't come together and all this air gets around. Can't get a good sound that way. That's hoarseness. That can be mild, but this person has horrible swelling. So vocal cord swelling is probably the most common cause of hoarseness overall. And the usual reason for the vocal cord swelling is infections. So if you have a cold or a sinus infection or something like that, you can get some swelling of your vocal cords. Vocal abuse, screaming loudly, singing too long, or things like that, or coughing for a prolonged period of time can also cause swelling in our vocal cords. Another really common cause is stomach acid reflux coming up and irritating the vocal cords. And finally, just drippage from the nose, like from allergies, can cause swelling of the vocal cords. So this vocal cord swelling is usually not serious, and we mostly know what we're supposed to do. Voice rest is very important. The more you talk and keep banging your vocal cords together, the longer the swelling will remain. Hydration is super important. Your body can't deal with the swelling unless you drink plenty of water. So drinking lots of water. I like people to use some liquid antacids. It coats the throat and prevents any reflux that they might have from causing additional swelling or problems. All right, so that was one problem, the vocal cord swelling. The next problem we want to talk about is, well, what if there's something else causing the vocal cords to not be able to come together? Here we're talking like if there's a lump. If there's a lump and you try to close your vocal cords, the lump is like having something in the hinge of the door, makes it so it can't close. There are lots of different things that can make lumps. This is a simple cyst that is causing a lump and is making it so the vocal cords won't come together. This is like a gigantic wart that's in there. It's benign, but it's a gigantic wart. But it can also be something very subtle. This white area in this patient is a small growth that's making it so the vocal cords don't work properly. That actually turned out to be a cancer. So vocal cord lumps can come from severe or prolonged voice abuse. I told you that voice abuse can cause some swelling. If you keep doing it, you'll basically get a cyst or a callus on the vocal cord that will make it so that the hoarseness just won't go away. We have a lot of benign growths that can happen on the vocal cords, and we also always worry about possible cancers in the vocal cords. So the third thing I want to talk about, the third general group of things that cause hoarseness, is vocal cord paralysis. These vocal cords, they come together, obviously, because they move. Well, what if one of them doesn't move? Then when they try to come together, this one will just sit there and you'll have this big open space and you'll be very breathy like that. So vocal cord paralysis can cause hoarseness. Vocal cord paralysis can come from a viral infection. You can just simply get a virus that knocks out one of your vocal cords. Typically, those get better. They take a long time, though, typically several months to get better. Surgical complications. If you had surgery in your neck, which could either be done by an ear, nose, and throat doctor for thyroid or some other type of surgery, or from your spine surgeon trying to get to the spine from the front, you can have surgical complications that can cause vocal cord paralysis. And in fact, the vocal cord nerve goes all the way down into the chest, especially on the left side, and comes back up. So having chest surgery can lead to complications of vocal cord paralysis. The other thing that can happen are growths, tumors. So anywhere along the course of that nerve, from where it starts in the brain, all the way down in the neck, down to the chest, and back up to the vocal cord, a growth along there that's pressing on the nerve can cause a vocal cord paralysis. So the question always is, well, when should I see a doctor? Because obviously if you're a little hoarse from a cold, you don't need to run in right away. But if you have hoarseness after a cold that doesn't clear up after about 10 days, after the cold's gone and you still have hoarseness, that's a good time to be seen. The other time you should be seen if you have sudden severe hoarseness. So if you were going along just fine and you have no cold, you have no infection, nothing's going on, and suddenly, boom, you're hoarse, you should go see a doctor. And the other thing is, if you have even a mild hoarseness that persists for more than a month, you should go see a doctor. And only ear, nose, and throat doctors are actually able to see vocal cords. Your regular doctor, he can look at the back of your throat, but he can't see your vocal cords. So if you need to see a doctor, come see one of us. Now, obviously, if you're in the Austin area, you're more than welcome to come see me. Just Google me, you'll find me there. But don't let this pass by without seeing a doctor if you've had prolonged hoarseness, sudden severe hoarseness, or hoarseness that doesn't clear up in a reasonable time after you've finished your cold. Remember, Dr. B Talks About is presented for information and is not the practice of medicine. If you think you have a problem, see a doctor. Don't think you can diagnose yourself by watching YouTube videos or going on Google. I appreciate you watching today. If you enjoy this, make sure and click the buttons below, like, subscribe, share, and hopefully you'll find some of our other videos that will be enjoyable to you in the Dr. B Talks About series. Thank you.